9 out of 10 office workers develop back pain. Almost none of them know the real cause, and it isn't their chair. Researchers call prolonged sitting disease, a term that didn't exist 20 years ago. Your spine evolved for constant micromovement. The damage stacks quietly, hour by hour. Most office chairs are built for a generic spine that doesn't actually exist. Flat, straight, symmetrical. Real spines curve in an S shape, and a chair without lumbar support forces your lower back to flatten unnaturally for hours at a time. A monitor set 2 inches too low pulls your neck forward. Slouching doesn't just look tired, it can multiply compressive force on your lower spine. Your muscles weren't designed to hold that load for hours. They fatigue, then your ligaments and discs quietly absorb the difference. Feet flat on the floor, hips slightly above knee level, spine stacked over your pelvis. This alignment isn't about looking professional. A muscle that never contracts stops acting as a pump for blood flow, and that stagnation is what turns mild stiffness into deep, aching tightness by mid-afternoon. Shoulder rolls and seated spinal twists aren't just stretches. They're mechanical nudges that force fluid back into tissue that's gone quiet. Set a movement reminder every 30 minutes, and you interrupt the stiffness cycle before it compounds. Wait until lunch to move, and you're undoing hours of buildup. This is also why people who fidget unconsciously often report less back pain. Stress doesn't stay in your head. It triggers an involuntary tightening from a threat response your body can't distinguish. Deep breathing activates your parasympathetic nervous system. A chair with real lumbar support holds your spine's natural curve, so your muscles don't have to fight gravity. Without that support, your deep spinal stabilizers stay mildly contracted. A short break doesn't just rest your mind. It physically repositions your spine. Lets compressed discs partially rehydrate. Even 90 seconds of walking restores circulation. Frequency matters more than duration. Pain that persists past 2 weeks, despite adjustments, usually means the problem isn't your discipline. It's a structural issue in your setup or movement pattern that self-correction alone can't fix. A physical therapist doesn't just treat pain. Back pain isn't an unavoidable cost of having a desk job. It's your body's most reliable signal that something in your setup, movement, or stress response needs to change. Take care.